Again, I bring to you another amendment that I hope will provide some additional necessary safeguards to make sure that we're addressing this public health emergency in the best way possible and making sure this doesn't become a statewide epidemic. And you may, if you're looking at it in your gadget, look at this amendment and say, well, how could that be? Because this amendment, it's one line, page 1, line 6 of the committee amendment, which of course becomes the bill, AM765, it strikes, keeps chlamydia as being available as an STD to be treated by expedited partner therapy, but strikes gonorrhea. And I want to outline why I think this is necessary to this discussion. It is in no way, shape, or form to somehow set up the scenario by which that I think gonorrhea is less of a problem or not at epidemic levels in Douglas County and at the very least public health emergency levels in other parts of the state. It's because you'll have a handout in a moment that's from a November 2012 Center for Disease Control and Prevention report on the guidance on the use of expedited partner therapy in the treatment of gonorrhea. And you'll find that there's a couple of very interesting points in that report that I think are relevant to AM765 and to the underlying committee amendment and to the bill. I think that this particular STD, gonorrhea, is too important to be part of expedited partner therapy. You'll find in this report, if you look through it, that we're experiencing a real problem with drug-resistant strains of this particular STD. I would draw your attention also to a letter that we all received at our office. A letter that we all received at our office yesterday, some of you may have read it, from the National Coalition of STD Directors. And it's actually a memo on drug-resistant gonorrhea and a challenge we can meet through public health investment, which is a whole other component of this discussion, but one that we probably won't talk about much today. I think that letter is particularly important. I didn't hand that out as a handout because I assume all of you had the opportunity, hopefully, to look through that when you received it at your office yesterday. I think this particular STD, and all of them, but this particular one is a terrible, awful, and pernicious problem, particularly for unborn children. You know, I missed part of the discussion yesterday because my wife Shawn and I, we have another member of our family that will be joining us this fall. We were actually at the doctor's appointment yesterday. Wasn't here yesterday morning because of that. And I was reminded when our physician, who's delivered a number of our children, outlined again, as she does for all of her patients in her practice, just how dangerous these STDs can be for unborn children. And I must say, I don't know that I should have paid more attention to that as the father now of 3 daughters, maybe 4, we'll find out this fall, especially, and our son, of course, too. As a parent, I should have paid more attention to that, but our children are young. But I was horrified when I heard from our healthcare provider just how dangerous this can be for babies. And the latent health concerns, sometimes for lifelong, that can haunt individuals when these STDs go untreated, or in the case of gonorrhea, not treated properly. Again, I'll reference back to the CDC report that's being handed out. You know, in the past 50 years as gonorrhea has been treated, pharmaceutical companies have always been kind of one step ahead, members, of this problem by a new antibiotic that could treat this terrible problem. Well, when you look at the CDC report, in addition to the memo that was mailed to our offices yesterday by the National STD Directors Association, you'll find that we're on the last generation of antibiotics for this terrible problem. And what they're finding is that oral antibiotics aren't enough to take care of the problem anymore in a lot of patients or partners in the case of EPT, or expedited partner therapy. And they're finding that you also in many cases need a shot administered by a medical practitioner in order to make sure that a patient or a partner isn't being reinfected. Well, clearly when you're talking about shots, that's a very difficult thing to do with EPT. Now you'll also notice in the CDC report, and I'm sure there may be those who will get on the microphone in a minute and address this, you'll also notice that there's a line that says that expedited partner therapy is better than no treatment at all for gonorrhea. And I suppose I wouldn't have any reason to disagree with that. I'm not a medical professional. But I would draw your attention to the fact that that report says that the CDC no longer recommends the routine use of oral administered antibiotics for the treatment of gonorrhea. My fear, members, is that gonorrhea is such a problem, not just in Douglas County, but in other parts of our state and definitely across our country, and as these reports indicate, it's a global problem. We have to be very careful, members, what we're doing here with public policy to make sure that while we're doing our very best to address what is a dire public health emergency, that we aren't at the same time having medical practitioners treat patients and prescribe for partners antibiotics that then those same individuals are contributing to the epidemic levels of this STD by reinfecting others and themselves, in particular when there may be pregnant women involved. As it's been noted, I think yesterday, I think if I recall the number correctly, I think it's either 1 in 7 or 1 in 9 babies in Nebraska are born premature. I would guess, although I don't know that I heard any statistics, although maybe there are some, that there are a number of those premature babies that an STD like gonorrhea or chlamydia is contributing to that premature birth, which in turn not only affects that family, but affects that baby, and in some cases that comes back to be our responsibility here in the legislature and the government of the state of Nebraska. So I bring this amendment to you as the only way that we could think of, that I could think of, to address this problem. It isn't to say that we don't want medical practitioners to be able to address gonorrhea. Absolutely we do. But as you'll see from the CDC report, the CDC really recommends that in the case of gonorrhea, that person is seeing a medical professional practitioner so that they can determine whether or not a shot is going to also be needed in addition to the oral antibiotics.